Hello everyone. Good afternoon. Good afternoon. Can you people hear me? Can you people hear me? Perfect. ऑडियो वीडियो सब ठीक आ रहा है ना? Good afternoon. Perfect. चलो फिर शुरू करते हैं. Let's start. So yesterday we wanted to start off with CNS, but unfortunately our Wi-Fi was not working. So लेवोडोपा से शुरू किया था, फिर वहीं पे रुक गई थी. So let's continue from the anti-Parkinson drugs. So when we want to discuss about anti-Parkinson drugs, we need to understand some very important basics. The basics are very important for this topic. अगर basic समझ नहीं आया तो कुछ भी समझ नहीं आएगा. So I want you people to understand. So let's start from the scratch again, because it was like, the video was removed, so it will be difficult for you people also to catch on to that. So that's why let's start from the beginning of the topic. All right. So when we want to start with the topic of anti-Parkinson drugs, so it's very easy to understand once you understand the pathogenesis behind it. Okay. So guys, it's like in the basal ganglia, we have an area called as substantia nigra. We have an area called as substantia nigra. So by now, when I'm talking about anti-Parkinson drugs, you guys would have remembered a lot about levodopa and carbidopa. पक्का रिमेंबर कर लिए होंगे. Apart from that, about the symptoms you might have remembered from the medicine, you might have learned everything about that. So let's learn about pharmacology behind it. Okay. So yes, exactly, that's what we are going to do. We are starting from the beginning. Okay. So when we are talking about central nervous system, we were talking about anti-Parkinson drugs. All right. So when I want to discuss about anti-Parkinson drugs, so very easy to understand once you understand about the dopamine. So basically, let's discuss about dopamine itself. What is dopamine, guys? So dopamine basically is a catecholamine. Dopamine is basically a catecholamine. Now this dopamine, it is having a characteristic. What is that characteristic? This catecholamine cannot cross the blood-brain barrier. Cannot cross the blood-brain barrier. Okay, if it cannot cross the blood-brain barrier, where am I going with this? So dopamine is a neurotransmitter which is present in the central nervous system as well. Apart from that, dopamine as a catecholamine which is circulating in the periphery in the bloodstream, right? So dopamine will activate your sympathetic activity also and dopaminergic receptors also. But at the same time, dopaminergic receptors are present in the central nervous system as well. So we need to learn about that. So if we need to learn about that, I want you people to have a basic understanding. Okay, so what is that basic understanding? Dopamine cannot cross the blood-brain barrier. This is the basic rule I want you people to remember. With that much being said, let's start the discussion. So here is it. Consider this is your blood-brain barrier. Thank you, sir. Consider this is your blood-brain barrier. Consider this is your blood-brain barrier. Now, my dear students, this is the side where I have a central nervous system, and here I have what is that? My peripheral circulation. Okay. Now, whatever dopamine which is present here, it cannot cross the blood-brain barrier. That is very clear for us. But what is the problem behind the Parkinson disorder? So the basic problem behind the Parkinson disorder is very simple to understand. There is a decrease of dopaminergic activity. What is that? There is a decrease of dopaminergic activity. Where exactly? In the basal ganglion. Where exactly in the basal ganglion? The area called as a dark area called as substantia nigra. That is called as substantia nigra. So inside the substantia nigra, what is not there? Dopamine activity is not there. So basically we need to send dopamine into the substantia nigra. That is our target. So once this is our target, my dear students, look at this. I can inject dopamine directly. If I inject dopamine directly, will it go to the brain directly? No, it cannot go. The problem is what? The problem is it cannot cross the blood-brain barrier. The problem is it cannot cross the blood-brain barrier. So for that purpose, what I did, I created a drug. What is the drug which we have created? The name of the drug is called as levodopa. What is the name of the drug? Levodopa. So basically levodopa can be considered as a prodrug. Why it is a prodrug, my dear students? You will understand it in some time. Okay. Now, Look here, we have a levodopa. Levodopa, what is that? Levodopa is a drug which can cross the blood-brain barrier. Levodopa क्या कर सकता है? It can cross the blood-brain barrier. So if it can cross the blood-brain barrier, what is the problem? Just give levodopa and Parkinson is treated. No, it doesn't work that way, my dear students. Why it doesn't work that way? There is a reason behind it. There is a reason behind it. The reason is very simple. In the peripheral circulation, we have an enzyme. The name of the enzyme is called as DDC. What is DDC? Dopa decarboxylase. What is that? Dopa decarboxylase. Now, dopa decarboxylase, what it will do? It will convert levodopa into dopamine in the peripheral circulation itself. If it converts it into the dopamine, will it cross the blood-brain barrier or it will not cross the blood-brain barrier? Batao. It will cross the blood-brain barrier or it will not cross the blood-brain barrier? So if I just give levodopa, that is not going to work out. Why it is not going to work out? Because I have an enzyme here, the culprit enzyme name called as dopa decarboxylase. He'll convert into dopamine. Now dopamine cannot cross the blood-brain barrier. So the problem is here. Now, what can I do? I can do a simple task. What is that simple task? I can just inhibit the dopa decarboxylase. So what is that? Dopa decarboxylase. So let's write down the most important. So that is called as DDC inhibitor. Dopa decarboxylase inhibitor. So which is this dopa decarboxylase inhibitor? My dear students, the name of the drug is called as carbidopa. Carbidopa. Now, what is a characteristic feature of carbidopa which you need to remember? Only then you will be able to understand the complete funda here. What is that? That is very simple. Carbidopa do not cross the blood-brain barrier. Carbidopa, what does it not do? It do not cross the blood-brain barrier. If it is not crossing the blood-brain barrier, means its action can be seen only where? In the periphery. Its action can be seen where? In the periphery only. Its action can be seen only in the periphery. So in the periphery alone, what it is going to do? It is going to inhibit the dopa decarboxylase. Once dopa decarboxylase is inhibited, levodopa will come into the central nervous system. Now levodopa, once it comes into the central nervous system, now what is going to happen? This fellow, again in the central nervous system, we have an enzyme called as dopa decarboxylase, my dear students. What is the name of the enzyme? Dopa decarboxylase. He will convert levodopa into dopamine. So basically, the drug was inactive. What was the drug? The drug levodopa was inactive. It became active after the action of enzyme. Which enzyme? Dopa decarboxylase inside the human body. So that is why it is called as prodrug. So basically, it was inactive outside of the body. It became active after it came into the human body. That is why we call it as what? A prodrug. Prodrug is what? Active outside of the body. So once the drug is given into the human body, it undergoes some effect. And forms the active metabolite or an active drug. That is only called as a prodrug. Now, my dear students, here, since we are discussing about this prodrug related statement, I want to give you people some interesting understanding about pharmacokinetics dynamics related topics here, which is that pharmacokinetic related topic. What exactly is that? So first, let's finish about levodopa and I'll give that points. Okay. So levodopa is DDC inhibitor and one more drug that is called as the levodopa itself. Carbidopa is what? Carbidopa is a DDC inhibitor and we have a drug called as levodopa. So in दोनों को हमेशा we should give in a combination or we should give levodopa alone. So always they should be given a combination, levodopa plus carbidopa. The students who are watching this live from Ukraine, for you people, most of your crow questions will rely on carbidopa plus levodopa. But rest of you who is watching this live for the MCA purpose, for you people, levodopa, carbidopa will not be a question. The question will be here for you people. So first question, carbidopa when it is given, which dopa decarboxylase is inhibited? This can be a possible question which can be asked for you people. So once I'm done with this, my dear students, I want you people to understand what exactly is that There is, see, after, so we are discussing complete story in the central nervous system right now. We are discussing the story in the central nervous system itself. Everybody able to understand? Audio, video, everything, no problem? Let's get into the central nervous system itself. Okay, so when we are talking about the central nervous system itself, my dear students, it's very easy to understand. We have an enzyme called as monoamino oxidase. What is the name of the enzyme? That is called as monoamino oxidase B, MAO-B. What is that? Monoamino oxidase B. What is that? MAO-B. So what is this MAO-B? This monoamino oxidase. See, my dear students, I have dopamine in the central nervous system. Okay, now the problem was what? Dopamine nihita. Dopamine was not there. Now we somehow sent dopamine into the central nervous system, but later this dopamine can be metabolized. This dopamine can be metabolized by an enzyme called as a MAO-B, that is called as monoamino oxidase B. So the target for us to what? The target was to increase the dopamine. तो क्या करो? By some simple MAO-B को inhibit करो, MAO-B को inhibit करो. So let's inhibit the MAO-B. So MAO-B inhibitor, monoamino oxidase B inhibitor, monoamino oxidase B inhibitor. The names of these drugs, can anybody tell me? So MAO-B inhibitor, the MAO-B inhibitors includes your salicylic, and we have one more drug that is called as rasagiline, that is rasagiline. So these are the two drugs which are what? MAO-B inhibitors, which you need to remember, Everybody clear so far? Everybody clear so far? कुछ तो रेस्पॉन्स करो यार, समझ आ रहा है कि नहीं आ रहा है? Able to understand or not? Sure. Let's continue then. I'm hoping you're understanding and I'm continuing. So MAO-B inhibitor. Once we are done with MAO-B inhibitor, my dear students, don't forget one statement. What is that? Dopamine. Whatever dopamine is there, dopamine is a type of catecholamine. Dopamine is a type of catecholamine. Dopamine is a type of catecholamine. Since dopamine is a type of catecholamine, all the catecholamines are metabolized into metanephrines. All the catecholamines are metabolized into metanephrines. Which is that enzyme which does with the help of an enzyme called as COMT. What is that? COMT. What is COMT? COMT full form is writing here. Note down. Catechol O methyl, catechol O methyl transferase, catechol O methyl transferase. Since catechol O methyl transferase is what? It is a compound, it is an enzyme which is doing what? Which is metabolizing your dopamine. So in this catechol O methyl transferase, COMT, is also present inside your central nervous system. Is also present inside your central nervous system. So if it is present inside your central nervous system, COMT can also do what? COMT can also break the dopamine. So if COMT can also break the dopamine, now let's inhibit COMT. So what is that? COMT inhibitors. They are called as COMT inhibitors. COMT inhibitors. The names of the drug COMT inhibitor, my dear students, write down. The drugs include entacapone, and we have one more drug that is called as tolcapone. So these both are capones, entacapone and tolcapone are what? These are the COMT inhibitor. These are what? COMT inhibitor. So once we're done with the COMT inhibitor, we are proceeding further towards the other drugs. Okay, so COMT inhibitors ho gaya. Okay, done. What we are done with that? We are done with your MAO-B inhibitor. Okay, once we are done with those things also, I want you people to understand some important aspect here. What is that? Let's consider this is your dopaminergic neuron. What is that? This is your dopaminergic neuron. So if this is your dopaminergic neuron, so my dear students, this dopaminergic neuron has a dopamine receptor on it. So dopamine was released. Okay. Now this dopamine could be metabolized by two enzymes. What are those two enzymes? One of them is COMT and another one is MAO-B. So both of these enzymes can inhibit. Both of these enzymes can be inhibited with the help of some drugs. So what happened? Our dopamine was there to act upon the dopaminergic receptor. Instead of that, we can have a better drug. What is a better drug? We can have a group of drugs which directly act upon. What is that? Dopamine receptor, which can directly act upon what? Dopamine receptor. So let's look at the drugs which are acting upon the dopamine receptor. So that include your dopamine agonist. This dopamine agonist, where exactly they are working, my dear students? Of course, on the central nervous system. They directly act upon the dopamine receptor. Okay. Now, when I'm talking about the drugs which act upon the dopamine receptor, we have two types of drugs in that. So they are called as ergot derivatives and non-ergot derivatives. Okay. Now, before getting into ergot and non-ergot derivatives, let's list out the drugs. Then we will get into which are those ergots and non-ergots. Okay. So the drugs include the most important drug number one. What is the drug number one? That is called, students, bromocriptine. What is that called as? Bromocriptine. Okay. Apart from bromocriptine, we have one more drug that is called as what is that? Cabergoline. What is that? Cabergoline. Apart from cabergoline, we have one more drug that is called as pramipexole. What is that called as? Pramipexole. These are the drugs which are present for what? Dopamine agonist. But recently we have latest one more drug. The name of the drug is called as, my dear students, ritogotin. What is the name of the drug? That is called as ritogotin. Ritogotin is a drug which can be used in Parkinson disorder, which might be a potential possible question for you people. What is ritogotin and what is the mode of administration? The mode of administration is a transdermal patches. Transdermal patches. So these are the most important aspects which you need to know about your dopamine related drugs. Okay. So what are the drugs we have? Bromocriptine, cabergoline, pramipexole and ritogotin. Bromocriptine is what? It is a purely a ergot derivative. Bromocriptine and cabergoline are what? Ergot derivatives. Bromocriptine and cabergoline are what? Ergot. So since we are talking about this much about the dopamine related story, let me teach you people some interesting aspects related to dopamine in the central nervous system. So what exactly dopamine can do in your central nervous system? So let's understand those, then it will be a very easy concept for us. Okay. So once before starting that video is stuck, just close the YouTube and open again. Video should not be stuck. It will be fine, I think. Just close the video, close it and open again. It will be fine. 1 second, guys. So guys, let's continue. So we have, what is the drug? That is your ritogotin. Okay. Now I wanted to teach you people about what? Teach you people about dopamine. Teach you people about what? Dopamine. When I want to teach you people about dopamine is very interesting substance inside your central nervous system. So when I'm talking about dopamine in the central nervous system, my dear student, it does so many things. So understand about this. Okay. So dopaminergic receptors are present. The receptors are present in an area called as CTZ. What is that? CTZ. What is CTZ? Chemotrigger zone. कौन सी zone है? Chemotrigger zone. So dopamine receptors are present. Okay. Receptors are present. Now dopamine, if it acts upon the CTZ on the dopaminergic receptor, it can cause the vomiting. This is one of the most important effects which you need to remember. Okay. Apart from that, Dopamine is responsible. See, dopaminergic, which receptor? There are something called as D2 receptors in the central nervous system. In the central nervous system, कौन सी D2 receptor मिल जाएंगे आपको? ये D2 receptors. If I stimulate the D2 receptor, it can cause a psychosis. It can cause the psychosis. So basically, all your antipsychotic drugs are based upon this only, the theory that dopamine receptors are responsible for psychosis. Dopamine receptors are responsible for psychosis. Now let's look at the other aspects. What is the other aspects, my dear students? The other aspect is dopamine receptors, when they are, when they are stimulated, or when there is a increased activity of dopamine, that will directly lead to decrease of prolactin. Isliye, that is the reason why we call dopamine as a prolactin inhibitory hormone. What do we call? Prolactin inhibitory hormone. Why we call it as a prolactin inhibitory hormone? Because it is the one which regulates the prolactin secretion. So more of dopamine, less of prolactin. If less of prolactin means what? Prolactin decrease has to occur. If we need to decrease the production of prolactin, क्या कर सकते हैं हम लोग आराम से we can use what? We can use dopaminergic drugs to do that as well. Okay. So with this much being said about the dopamine, apart from that, even there is interesting one more phenomenon. So we have a center that is called as thermostat. What is that center? Thermostat. If dopamine receptors are stimulated in an area called as thermostat, that can lead to change of your altered body temperature. So listen to me very carefully here. In the thermostat, there can be a stimulation of dopamine receptor, there can be a inhibition of dopaminergic receptor. Okay. But if I inhibit dopamine receptors in the thermostat, it will cause what? It will cause something called as a neuroleptic. What is that? Neuroleptic analgesia? No, not neuroleptic analgesia, but it will lead to neuroleptic induced hyperthermia. This particular topic you'll understand with your antipsychotics. So before getting anywhere, listen to me. If more of dopamine, there is a decrease of prolactin. That is called as what? Neuroleptic malignant syndrome or induced hyperthermia. I'll come to it. कोई बात नहीं, आराम से काले खाते खाते सुन लो, कोई दिक्कत नहीं, ठीक है. So listen to me very carefully. Why am I talking about this? Because I want to make you people write down the uses of bromocriptine, doctors. What is that? Bromocriptine. So bromocriptine is a drug. What exactly it is doing? Bromocriptine is a drug which stimulates which receptor? Dopamine receptor. Since it is stimulating the dopamine receptor, so now what is going to happen? That is very simple. Dopamine receptor stimulated, that means there will be decrease of prolactin. So that is the reason why we are using this drug as a drug of choice in a condition called as prolactin. What is that condition? Prolactinoma. If not bromocriptine, we can use cabergoline. So this is the reason why we are using it in the prolactinoma. This is the story of our what is that? Bromocriptine and cabergoline. So once we are done with that, we are left with one and only simple antiparkinson drug. But it's not is released. We have a drug called as amantadine. What is the name of the drug called as? Amantadine. What is amantadine? Amantadine is an antiviral drug, my dear friends. What is that? It's an antiviral drug. Though it is an antiviral drug, antiviral drug, somehow it increased the availability. It increased the availability of what? Availability of your one important aspect, that is your dopamine. So that is why we can use the drug in the treatment of anti-Parkinson drug, but not as a drug of choice. So this is the story of your anti-Parkinson drugs. This is the story of your anti-Parkinson drugs. So this finishes what? Anti-Parkinson drugs. So once we're done with anti-Parkinson drugs, let's proceed into the next group of drugs. What is that next group of drugs which we are going to discuss, my dear students? The next group of drugs will be what? They will be called as your opioids. They will be called as what? Opioids, my dear students. What is that? Opioids. Okay. What are opioids? Opioids. So what are opioids? Really sorry. Look at this. There is some problem with this. Opioids. Okay. Okay. Everybody able to understand? Everybody able to hear me? Everything is clear for you so far? कुछ तो बोलो भाई. Everybody able to understand? Okay, let's continue. So basically, opioids are the drugs. So before getting into opioids, you people have to have a little bit history of the opioids. Okay, so opioids are derived from a plant. Opioids are naturally derived from a plant called as poppy plant. Okay, so this poppy, what it does? It will give what? It is the source of alkaloid. The alkaloids from the poppy is a source for your opioids. One of the oldest opioid is heroin. What is that? Heroin. Heroin is what? Heroin is one of the oldest opioid. Heroin is one of the oldest opioid. Now, when I'm talking about heroin being one of the oldest opioid, is it used as a drug? My dear students, no, because of its highly addictive property and etc. etc. It is not used as a drug. It is not used as a drug. It is not used as a drug. Okay, so if it is not used as a drug, so what are the other opioids we have, and what is the types of opioids? What exactly they do? Let's understand about those things. Okay, so when I want to discuss about opioids, opioid drugs act upon what? Act upon opioid receptor. Act upon what? Opioid receptors. Opioid receptors. So if they are acting upon the opioid receptor, my dear students, it's very simple. They will stimulate the opioid receptor. They will stimulate the opioid receptor. Over मतलब opioid receptor समझ लो. Now when I'm talking about opioid receptor, my dear students, I want you people to know one important aspect. What is that? These opioid receptors are divided into multiple types of kappa, mu, and delta. Kappa, mu and delta. ओके, मॉर्फिन भी ओल्डेस्ट है. मॉर्फिन का बाप है भाई, ये मॉर्फिन से भी बहुत पुराना है. दैट इज हेरोइन. ओके, मॉर्फिन का स्टोरी में आते हैं. मॉर्फिन इज यूज्ड एज ए ड्रग. इट इज नॉट समथिंग लाइक कॉन्ट्राबैंड. इट इज नॉट कॉन्ट्राबैंड, बट हेरोइन कम्स अंडर कॉन्ट्राबैंड. किसी को तुम हेरोइन लिख के नहीं भेज सकते हो, बट यू कैन प्रिस्क्राइब मॉर्फिन. समझ लो. प्रैक्टिस में मॉर्फिन बंद नहीं है. प्रैक्टिस में मॉर्फिन बंद नहीं है. प्रैक्टिस में बिल्कुल अलाउड है मॉर्फिन. वी डू यूज इट. ओके, मॉर्फिन यूज करते हैं भाई. किसने बोला मॉर्फिन यूज नहीं करते? बिल्कुल यूज करते हैं मॉर्फिन को. चलो शुरू करते हैं. तो क्या है ये ओपियोइड रिसेप्टर? नाउ माय डियर स्टूडेंट्स, व्हेन आई एम टॉकिंग अबाउट ओपियोइड रिसेप्टर, these opioid receptors are present usually on one important pathway, that is your pain pathway. Can anybody tell me the technical name for pain pathway? They're present in the pain pathway. What is the pain pathway? That is called as nociception. That is called as nociception pathway. So nociception pathway में क्या है तुम्हारा? Opioid receptors are present. If the opioid receptors are present in the nociception pathway, now my dear students, look here and understand. Consider this is one neuron. This is one neuron in where inside your nociception pathway. Inside your nociception pathway. So in the pain pathway, we have what? We have one neuron. Now these opioids receptors are present right here. So opioid receptor is present right here. Now whenever I stimulate this opioid receptor, what I'll do, whenever I stimulate this opioid receptor, this fellow will allow the influx of chloride ions. Once opioid receptor opens up, what happened? Influx of chloride ions. If there is an influx of chloride ions, what happens to the neuron? Neuron automatically undergoes a condition called as hyperpolarization. Automatically it will become what? Hyperpolarized. If it is hyperpolarized, definitely it will not be firing immediately, or it will not be firing with a less threshold, so the pain activity will be going down. That's how we are decreasing the pain, by stimulating the opioid receptor. So opioid receptors are basically what type of receptor? They are ion channel receptor. Likh lo bhai log, ion channel receptors. Okay. Now, when I'm talking about opioid receptors, ion channel receptor, सब कुछ तो पढ़ा दिया मैंने. Now, I want you people to understand some important aspects. What is that important aspect here? So that is very simple for you people. These opioid drugs, whatever is there, they are divided into multiple types. And based upon what? Based on their mechanism, we can classify, or we can classify based upon what? Based upon their mechanism of action. So when I'm talking about that, whenever I'm talking about the drugs, so drugs se pehle main kya padhata hu? I will tell you about what it does, then only I will tell you what is the drug. So that is our way of learning. So let's learn about the effect of opioids on the human body. Effect of opioids on the human body. The effect of opioids on the human body is very simple for you people to understand, with a mnemonic called as PM case. PM case. What is the mnemonic? The mnemonic is very simple. The mnemonic is PM case. What exactly is PM case? The PM case is a mnemonic to remember the effect of opioids on the body. Effect of opioids on the human body. So what is P? P for they cause physical dependence, my dear students. They cause physical dependence. Okay. Apart from that, they will cause meiosis. Meiosis means constriction of the pupil. Apart from that, they cause, what is that? They cause cough suppression. Along with cough suppression, they also do one more thing that is called as constipation. What does it do? It also does constipation. Okay. A for what? They cause analgesia. They cause what? Analgesia. What is analgesia? Analgesia is nothing but to decrease the pain. They decrease the pain. Okay. If they are decreasing the pain, that is the reason why we use them in the medical practice. What about R? R for respiratory suppression. Basically, they're working on what? They're working on the respiratory centers. If they're working on the respiratory centers, my dear students, on the respiratory centers, when they're working, they also cause cough suppression. They also cause what? Cough suppression. Okay, why am I telling you all this? Because in this only I can give you people complete use study. E for euphoria. Euphoria from psychiatry. Can anybody define euphoria? What is euphoria? कोई बता दो euphoria क्या होता है? What is euphoria? What is euphoria? What is euphoria? चलो माय डियर स्टूडेंट्स, लेट्स कंटिन्यू। यहाँ पे कुछ समथिंग वाज एक्सेसिव हैप्पी, सिर्फ एक्सेसिव हैप्पी, और देयर इज इवन बेटर डेफिनेशन ऑफ इट, even better definition is there for it. So the better definition is, you're absolutely right, excessive happiness. But even better definition is feeling of extreme happiness. This is the word you need to mention whenever you define the euphoria, feeling of extreme happiness. ये बात को भूलना मत, okay? So feeling as per what? As per वो बहुत खुश हो गया, खुश होने के बाद what he'll do at the end, he'll sleep off. That is a effect called as a sedation, my dear students. What is that called as? That's called as sedation. हाँ, मस्त हो जाना, पूरा फील होता है, फील लेता है बंदा. So can anybody tell me which is that opioid which is banned in few places of India? There are two opioids which are banned. सोच लो, तब तक पढ़ा देता हूं. अरे उतना भी कॉम्प्लिकेट मत करो. सिंपल, फीलिंग ऑफ एक्सट्रीम हैप्पीनेस इज यूफोरिया. यूफोरिया कैसे भी आ सकते हैं. यूफोरिया कैन बी ड्यू टू एन गुड न्यूज. Euphoria can be due to a substance abuse. Anything can cause euphoria. That is not the problem here. The problem is might be a substance, might be an event, might be a news, might be anything. If the person is feeling extreme happiness, then it is called as euphoria. Then it is called as euphoria. That's the story of your opioids on the body. So once you understood about the effects of opioids on the body, चलो फिर आगे बढ़ते हम लोग सीख लेते हैं. So when we want to continue the discussion, I want you people to understand the drugs are divided. Marijuana is a totally different thing. Marijuana contains THC. What is THC? Tetrahydrocannabinol. The effect of marijuana is because of the tetrahydrocannabinol. It is not a thing which is what from the opioid. It is for this thing. Okay, now THC, not IHC, that is your THC. Okay my dear student, before going, very good, ये हो सकता है. ये पॉसिबल पक्का भाई साहब. यूफोरिया आना चाहिए एग्जाम के बाद, तभी मतलब परफेक्ट है कि तुम लोग पास हो जाओगे. चलो फिर आगे बढ़ते हैं. वंस आई वांट टू कंटिन्यू. सो वी हैव नेचुरली इन द ह्यूमन बॉडी there are natural opioids, naturally produced opioids. Which are those natural opioids? Basically endogenous means तुम्हारा बॉडी के अंदर ही, in your body itself you have some endogenous opioids that are named as endorphins, my dear doctors. What is that called as? एंडोर्फिन्स. उनको क्या बोलते हो? एंडोर्फिन्स कहते हो. उनको क्या बोलते हो? एंडोर्फिन्स. ओके, नाउ once we understand about endorphins, endorphins are basically what? Your naturally produced opioids. तो आगे बढ़ना है तो क्या करना है? Let's start with the opioid drugs. So opioid drugs are divided into opioid agonist. Opioid agonist का मतलब क्या हुआ? They stimulate the opioid receptor having a positive intrinsic activity. Now when I'm talking about opioid agonist, my dear students, we have drugs such as one of the most important drug that is called as your morphine. Morphine is used in the clinical practice, so don't get confused. Okay, now when you write down about morphine, there only write down morphine is a prototype drug. Morphine is what? It is a type of prototype drug. क्या है ये? This is a prototype drug. Prototype drug means what? It possesses all the properties of opioids. मतलब क्या है? Morphine can produce all the effects. What is the mnemonic? I'm really sorry. What is the mnemonic? The mnemonic is PM case. The mnemonic is what? PM case. So all the PM case effects can be produced by your what? By your morphine. That is why we call it as a prototype drug. Apart from that morphine, this is the question number 1. What is the prototype opioid? Can be asked, which was already previously asked in your exam. The next possible question क्या है? The next possible thing we need to understand, that is called as a Fentanyl, my dear students. Fentanyl was asked around 3 times. What is this fentanyl? Fentanyl is a synthetic opioid. Right now, fentanyl is what? A synthetic opioid. What's it? A synthetic opioid. A synthetic opioid. Synthetic opioid, my dear students, is it natural or artificial? Artificial one, agreed. And synthetic opioid, and it is the most potent opioid. Okay, most potent opioid, most potent opioid. So this is the point which I want you people to remember. A question बहुत बार आया हुआ है, आएगा भी आता है. So please remember on 12th of December आप लोगों को ये क्वेश्चन दिख जाएगा, तो यूफोरिया आना चाहिए, बिकॉज तुम्हें आंसर पता होता है. व्हाट इज द स्ट्रॉन्गेस्ट ओपियोइड? दैट इज योर फेंटनिल. दैट इज योर फेंटनिल. जो बैन है मैं बताता हूँ, जो बैन है मैं बताता हूँ. दैट टू विच पार्ट ऑफ इंडिया आल्सो आई विल टेल यू पीपल व्हेन आई कम टू इट. ओके. Okay, then apart from that, we have one more drug that is called as codeine, my dear students. What is that called as? Codeine. Now, codeine is banned in many places. Codeine is banned in many places. Codeine is banned in many places. It comes under a brand name called as Corex. Cough syrup में आता है. So, what is codeine? Codeine is a type of. Codeine is a type of. What is that? Codeine is a type of anti-tussive drug. What is that? Anti-tussive drug. What do I mean by anti-tussive drug? Anti-tussive drug means what? It causes the cough suppression. It causes the cough suppression. So that is why we use it in the treatment of. We use it in the treatment of dry cough. We use it in the treatment of dry cough. So this is the anti-tussive property, codeine. Okay. Now, my dear students, once we're done with that, apart from codeine, we have other drugs such as synthetic opioid that is called as tramadol. That is called as tramadol. Tramadol is again many places it is banned. Many places it is banned, but it is a weak opioid which can be used for the normal pain management. For the normal pain management. ये जो banned है, ठीक है. ट्रेमडॉल काम पे बैंड है, स्पेशली राजस्थान में, ठीक है, क्योंकि इसके वजह से बहुत एडिक्शन हो रहा था आफ्टर कोडीन. ओके. नाउ ट्रेमडॉल, ओके, डन. कोडीन हो गया, ओके, डन. ओके. देन नाउ माय डियर स्टूडेंट्स, वी हैव वन मोर ड्रग हियर. व्हाट इज द नेम ऑफ दैट ओपियोइड? द नेम ऑफ दैट ओपियोइड दैट वुड बी कॉल्ड एज मेथाडोन. दैट वुड बी कॉल्ड एज मेथाडोन. दैट वुड बी कॉल्ड एज मेथाडोन. ओके. ये सारे क्या हो गया भाई? ये सारे opioid agonist हो गया. Now when I'm talking about opioid agonist, my dear students, I want you people to understand one of the most important aspect, that is your methadone. Methadone is a type of drug which is used in the treatment of opioid withdrawal management. Opioid withdrawal management. Any patient who, if he is addicted to heroin, for example, if he is addicted to heroin, means what? Now he is undergoing the treatment for that. Opioid withdrawal का long term management में methadone is used, which is a drug which is used. Methadone is used. OP treatment of opioid withdrawal का टाइम पे मेथाडोन को यूज करते हैं. Now overall uses of your opioids, of your opioid agonists. Write down the names of those drugs. The names of the drugs are very sorry, uses of those drugs. One second guys, one second. There is a lots of disturbance. Let me get ready. Really sorry, we are not talking about Ayurvedic medicines here. Let's continue with the our medicine, that is of pharmacology here. Okay, so we are talking about the uses. What is the uses of the opioids? So the uses of the opioids are the most important use. The use number 1, write down my dear students. It is used in the pain management of the cancer patient. So cancer related pain management में use करते हो. Cancer related pain management में the most importantly 2 drugs are used in the cancer management pain. One of them is morphine. Another one which can be used is fentanyl. Another one which can be used is fentanyl. Again, when I'm talking about fentanyl, fentanyl can be available in the form of patches. Fentanyl is available in the form of patches. Fentanyl is available in the form of patches. Apart from the cancer pain, where else it can be used? So it can be used in the trauma patients. So trauma patients may, if they are under a severe pain, so polytrauma, especially polytrauma patients may, we can use them. Apart from that, where else we can use opioids? My dear students, one of the most important use is your myocardial infarction when there is a severe chest pain. When there is a severe chest pain. Apart from that, is there any other use for opioids? Yes, there is one use that is can be considered in the pulmonary edema. Pulmonary edema. In the pulmonary edema, only drug which can be helpful, that is your morphine. That is your morphine. Why morphine? How exactly it helps in pulmonary edema, we don't know, but it prevents the formation of froth. ये क्या करता है? फ्रॉथ, झाग बनने का प्रिवेंट करता है. फ्रॉथ फॉर्मेशन इज प्रिवेंटेड. फ्रॉथ formation decrease the froth formation. That is done by your opioid agonist, that is your morphine. So these are the uses related to your opioid agonist. So once we are done with the opioid agonist, I want you people to understand the next important drugs. इसके अंदर what else we have? We have one more group of drugs. They are called as mixed drugs. What is that? They are called as mixed drugs. What is mixed? Mixed means mixed agonist and antagonist. Mixed agonist and antagonist. All I want you people to do is knowing the name of these drugs. That is more than enough for you people. So what is this mixed agonist and antagonist are doing? Mixed agonist and antagonist are doing very simple. I have a drug X. Now this drug X, I have mu receptor also, I have kappa receptor also. Now this drug X would be stimulating mu receptor, but at the same time it might be blocking the kappa receptor. So it is mixed agonist and antagonist to the opioid receptor. These type of drugs are mixed ones. So what are the mixed opioid agonist and antagonist drugs? The mixed agonist antagonist drugs we have our pentazocaine. What is the name of the drug called as? Pentazocaine. This is one of the time you need to remember everything. Pentazocaine. Apart from pentazocaine, we have one more drug that is called as buprenorphine. What is that? Buprenorphine. So these are the two drugs which are mixed opioid agonist and antagonist. So once we are done with this mixed agonist and antagonist, all we are left with one of the last most important ones are opioid antagonists. What are those? Opioid antagonists. Opioid antagonists are what? Opioid antagonists are the group of drugs which are what? Which block the opioid receptor. If they block the opioid receptor, my dear students, I want you people to understand one of the most important aspect. What exactly is that? So opioid antagonists are the group of drugs that includes your naloxone and naltrexone and naltrexone. So these are the ones opioid antagonists. If they're blocking the opioid receptor, where do we use them? We use them as an antidote for opioid overdose. We use them as what? Antidote for overdose. Antidote for opioid overdose. This is the story of your opioids. Among these two drugs, even if they go even more deeper, if they dig inside, so I want you people to know naltrexone is the long-acting. What is that? Naltrexone is a long-acting one. Naloxone is a short-acting one. Naloxone is what? Short-acting one. One note is responding a bit slowly, so please cooperate with me. So we have what? We have naloxone and naltrexone. In that क्या क्या है हमारे पास? Naloxone is what? Naloxone is a short acting. Naltrexone is a long acting. Okay, everybody able to understand me or not? कुछ स्ट्रक हो रहा है क्या? ऑडियो वीडियो पे कोई दिक्कत आ रहा है? Naloxone and naltrexone. Among these two, naloxone is the short acting. So short acting drugs are fast acting drugs. Simple rule याद कर लो. Short acting drugs are फास्ट एक्टिंग ड्रग्स. तो ओपियोइड ओवरडोज में इमीडिएट इमरजेंसी में मैनेजमेंट के लिए द बेस्ट वन इज naloxone. This is also a question which was previously asked and which can be asked again and again. So please at this point there can be a question from here. What is the antidote of opioid? Everybody clear so far? हाँ या ना, कुछ तो बोलो भाई. चलो, once we understood about this, we are done with the opioids also. Once we are done with the opioids, my dear students, let's get into the next important aspect. What is that next important aspect? That next important aspect for you people is very interesting thing. That interesting thing is called as anxiolytics. What is the drugs? They are called as anxiolytics. Anxiolytic का मतलब क्या हो गया? They are decreasing your anxiety. Anxiolytics. Along with anxiolytics, we have one more group of drugs. These drugs work as anxiolytics and they do also work as a hypnotics. So basically hypnotic means what? They do cause the sedation. मतलब नींद में सुला देते हैं आप लोगों को. Let's discuss about anxiolytic and hypnotic drugs. When I'm talking about anxiolytic and hypnotic drugs, उसको शुरू करने से पहले हम लोगों को ले लेते हैं एक छोटा सा break of how long? A break of 10 minutes. So now it is 2:03. So we will start our class at 2:15. को शुरू करते हैं. From 2:15 we will continue the anxiolytic, hypnotic and antiepileptics. Will be done with the central nervous system. Okay? 2:15. If not 2:15, guys, from 2:15 just keep looking at our channel. By 2:15 I'll be live. Maybe 1 or 2 minutes late I'll be live. Okay? Is that all right for everyone? I know your brain is already saturated enough, so that's why I'm thinking to give a break. ठीक है, चलो ले लो break.